everyone, welcome back to my channel Goan English Vibes. Today's session is very special, insightful, and informative, especially for my women audience. Today we are going to talk about women's health, awareness, and many more important things which mainly people they hesitate, reluctant to discuss openly. And I am today very much delighted and glad to welcome Padma ma'am. She is renowned and acclaimed gynecologist, and today she is here to guide us on women's gynecological problems. So, my dear friends, stay tuned till the end because in this conversation, you will get to know many more information, and that information will definitely, it can truly enhance your knowledge. So, Padma ma'am, welcome to my channel, and it's my pleasure and privilege to have you on my channel. So, Padma ma'am, after long hiatus, we are meeting. So, ma'am, how have you been?
I'm great. I'm doing great, Sangeeta, and thank you for having me here on your channel. And I hope our today's conversation will definitely give valuable insight to your viewers about health.
Okay.
Yes.
Yes, ma'am. And yes, ma'am, I truly grateful to you, bottom of my heart, because you took out valuable time for me and you are here. It means a lot to me. I can't tell you it in word. It is ineffable. Okay. So, Padma ma'am, before dive into session, I would like to ask you, could you introduce yourself, please, for my audience? Little brief introduction, please.
Absolutely, Sangeeta. So, hello everyone, Namaskar. I am Dr. Padma Jadhav. I am from Gokak, Karnataka, and I am obstetrician and gynecologist. And I am in this field for 30 years in working independently. And I am very much passionate about treating my patient with a blend of modern medicine and meaningful lifestyle changes. I have a great faith in prevention is better than cure, and I feel I have strong faith in body's innate ability to heal by itself when provided with right environment. So this is all about me, Sangeeta.
Wow, great, ma'am. Great. It's lovely. Okay, honestly speaking, I have butterflies in my stomach, mixed feeling, happiness, jittery, excitement also, because I was waiting for this podcast. You can say for long time. And today that my dream came true because I know your life structure, lifestyle, and your OPD, your all things are very hectic, but still you took out some time for me and you have given me this particular time, so I'm really grateful, ma'am. I'm telling again and again because I can't control myself. So once again I would like to say you thank you at the bottom of my heart.
Yeah, it is my pleasure, Sangeeta, because I also love to talk to you and I also love to talk to people about this health insights. So this will be a great chance for me to share my knowledge to your audience as well.
Because ma'am, your nature is philanthropist like that, and you always like to help people, and whatever knowledge you have, you always impart it. Because see, I am telling you very true, because mostly gynecologists or any doctor, they don't have time to speak with their patient. And sometimes it is good also. Good means why I'm telling, because sometimes patients ask So many, sometimes useful, sometimes useless questions also. And doctor doesn't have that time of patience because their life is already very hectic life. Okay, so they don't have time. But you are not like that. You have that, patience. I know how much patience you have. You always another person with poised demeanor, calm demeanor, and you have that nature to listen another person. That is very important because every patient, what they want, to speak with doctor more and more, and then they feel relaxed. Actually, they don't care about medicine and those things. They just want to speak with doctor. But doctor, they don't have time to speak with their patients a lot, and it is also correct. But you are not like that. You always explain patient very nicely with patience. You always listen patient with patience. So that is a very important thing. And because of that only
Yeah.
patient get relief, no need to medicine and another treatment only.
No,
Okay.
to tell you the truth, that is one of my tool to diagnose
Yeah.
the patient's problem. Because when I talk to patient, when I take history, I get lot of information about her. See, it is not that always she is having physical disease. Most of the time, the disease is somewhere else. Like
Yes.
she has so much of stress, and if I talk to her, and if I find out what problem she is having, then it becomes very much easy for me to treat her. So, when I talk to her, she gets relaxed, and she speaks very freely about
Hmm.
her problem at home and about her health also, and that is very important for me.
Exactly. Because ma'am, since my childhood, I have been listening with doctor and with advocate. Don't hide anything. Okay, you have to tell them everything truth. Then only it will easy for them also to diagnose, because most of the time people, they are very much ladies, actually women's, actually they are reluctant to speak about their problems. And that's why today I have chosen this topic only related gynec only. So ma'am, my first question for you, that how often should a woman visit a gynecologist for a routine checkup, even if she feels okay, or she feels perfectly fine?
Yeah. So, see, as per books and as per my experience, I always tell patients, those who are more above the age of 35. So, I always tell them to undergo annual checkup. Annual checkup means general checkup every yearly. Because, see what happened, now you said that she feels that she is perfectly fine, but in the hustle of our life, what we do, we take our body for granted. And when this happens, uh, even though body is giving us subtle signals, we just ignore it. We prefer to ignore those signals, and we think that no, I am in good shape, I am in good health, so there is no need to go to doctor. And then suddenly, the body has also its limit. So sudden, see, body it tolerates, and again at certain level, it breaks down, and then you land up in some bigger problem, and you go to doctor, and then you have to shell out a lot of money and lot of time, and lot of pain is also there. You have to suffer from that pain. So it is always better to undergo annual checkup, and in this annual checkup, we examine patient thoroughly. We check her BP and all the systems, and we check her weight as well. And from that examination, we get some clue. And along with that examination, we advise patient to undergo some investigations like HB and blood sugar levels, then thyroid levels,
Okay.
then renal profile, liver profile, lipid profile. So these and vitamin B12 levels, then vitamin D levels. So these are few investigation we tell them to get done, and with that we get some clues about the diseases like anemia, then cardiac diseases, liver diseases, or kidney diseases, and then thyroid levels. So, and then some deficiencies like vitamin B12 deficiency and vitamin D deficiency, and yeah, general status of the patient. So these why we tell them to undergo annual checkup, because from this checkup we can pick up certain diseases in early stages, so that
So,
we can intervene.
Padma ma'am, annual checkup you told means yearly checkup you are telling, right?
Yes, yearly means annual is yearly one, every
Yes.
year.
Every year they
Yes.
have to do. And just could you repeat that test? Then our audience they will get to know more idea. Which test can you repeat again?
Okay, so the HbCBC,
Okay.
blood sugar levels,
Mm-hmm.
thyroid level,
Okay.
liver profile,
Mm-hmm.
renal profile,
Okay.
lipid profile,
Mm-hmm.
vitamin B12 levels, vitamin D,
Okay.
and then calcium levels and electrolyte levels.
Okay.
We
Got
are,
it.
yeah.
Okay.
So these are the investigations we tell them to get done. And with those investigations, we can pick up certain diseases, certain problems in early stages, and so that we can intervene and we can treat patient immediately. And for gynec patient, there are two more tests we advise,
Hmm.
and they are pap smear. So pap smear is the screening test for cervical cancer. There is
Mm-hmm.
another test, HPV DNA test, and that is also for screening of cervical cancer. So if we are doing pap smear, then we have to repeat it every 3 yearly. If we are doing combined HPV DNA plus pap smear, then we have to repeat it every 5 years. And another test is there, that is mammography. For personally, I advise them to go undergo. I tell them to check themselves by palpating their breast, uh, and another way is ultrasonography. So that is a very useful test to get done. And if something abnormal is picked up in that test, then I advise them to undergo mammography. So it has to done every 2 hours, 2 yearly.
Okay. 2 years.
So these are the few tests we tell them to get done.
Okay. Means only this pap smear and another test HPV one you told. So that
H-
two test HP
HPV DNA,
DNA. Okay. It is
human
related to gynec.
papilloma virus.
Yes. Okay. Means along with this test, that two tests they have to do. It is about gynec. Means it is specially
Yes,
about gynec. Okay. Got it.
CANEC.
Okay. So you told after 35 yearly checkup, right?
Yes,
Okay.
after 35.
Okay. Wow. You know, Padma ma'am, because lot of ladies they are unaware about this all tests because we only know hemoglobin test, blood test, urine test. That is very common. We all know. But what you specifically you have told, it is very important to know each and every lady, right? Because I always believe that precaution is better than cure. If you get to know at early stage, then you can do lot of things. Otherwise, when it become worse, doctor also can't do anything, right? So these tests
Yes.
are very important. Okay. Okay, Padma ma'am, my second question is that what are the most common health issues you see among women nowadays? Because now it is a technological era. Our life is full of hustle, bustle, pollution, lot of things are there. So now what are the most common health issues you are seeing in your OPD on daily basis?
Yeah, actually, generally, patient they come with symptoms of generalized weakness, body ache, joint pains, or lethargy, and then menstrual disorders. But when we check patient, then we find out that anemia, iron deficiency anemia, or many nutritional deficiencies like vitamin B12 deficiency, vitamin D deficiency, They are very common among women. And then well, even calcium levels are very low. Vitamin D levels are very low. So many patients, they are suffering from osteopenia or osteoporosis, but they don't know about it. Then hypertension, that is another thing. Diabetes, I'm seeing so many patients of diabetes in my OPD. Recently, I picked up a girl who came to me with menstrual disorder. She has frequent cycles, and she was only 19 years old.
Oh my
But
God.
it is now over the experience I have come to know that when patient is having menstrual irregularities, invariably she has insulin insensitivity or diabetes. So I tell them to undergo blood sugar levels, to get blood sugar levels. And that 19-year-old girl, she has diabetes.
Oh my
So I
God.
picked it up very early. And now she
Mhm.
is, with medication, she is settled. So it is like we think that only menstrual irregularity, we give symptomatic treatment and that's all. It is not so. So it is connected to something else. Your body is giving signals and your body is telling you to take care of her.
Yeah,
So
right.
this is, and apart from that, thyroid disorders are there. Then mental, I mean psychological health, so many patients, they are suffering from depression, anxiety, fear. So that is also another issue. Then PCOS and endometriosis. These are also common problem patients are coming with. And then occasionally CA breast or CA cancer of cervical cancer. So these are the few uh, problems the patient they come up with to to my OPD.
Okay. It is
And
not.
digestion issues. Yeah, another thing is digestion issue. That is very, very common because nowadays we are not eating proper food. So what we think what we are eating is healthy, because I have seen many girls and they come like they are only eating atta noodles and they tell me we are eating healthy atta noodles. So that is
Oh
healthy
my God.
so that is healthy for my body. But they don't understand that they are literally eating junk. So I tell them when you eat packaged food, you just make a habit to look at the label, and
Hmm.
then I tell them to take a short I mean picture of that label, and go on the Google and ask Google how many diseases I am going to get because of this preservative in coming 10 years. Then you will realize how much poison you are putting in your body.
And you know, ma'am, I would like to share with you. Recently, we visited one DMart, and my son, he was, he was watching that label and everything, and I was surprised because earlier he was not like that, but now he is very much health conscious. And I was also, I never ever saw, any label and anything, because it is very small handwriting, and I'm not very much habitual to see those label. But my son, he started nowadays, and I felt so happy
Yes,
that day, because he told me, mama, I don't want now biscuits and those things, that bakery products, don't take bakery products. And I was happy. You know why
absolutely.
I was happy? Because I save my lot of money. So I was happy for that, and he was happy for his health and everything. But it's very important, you told here a very nice point,
Yes,
that
yes,
we have to see that label, actually what poison we are taking, right?
yes, yes. Yeah, that is another thing.
Exactly. Okay.
Yes,
So, Padma ma'am, third question, that irregular periods are very common nowadays. Okay. So, what could
yes,
be
yes.
the reason behind this, and when should be concerned to gynecologist for this problem?
Okay, see, our menstrual cycle is a great symphony of well orchestrated symphony of hormones. So these, the hormones estrogen and progesterone. So these are responsible for a woman getting menstruation. So these hormones are secreted by ovaries, but these ovaries are controlled by the hormones called as FSH and LH, which are secreted by pituitary gland. And these FSH and LH, they are controlled by hormones called as gonadotropin releasing hormone, which are secreted by hypothalamus. Why I'm telling you that?
Hmm.
Because see, it is all lying here in our brain. So
Hypothalamus.
brain, it has got complete control of our hormonal system. So hypothalamus, pituitary, ovary, and then uterus. This is how the menstrual cycle is interdependent with each other.
Okay.
So if something goes wrong at any level, like at brain level or at over at the level of ovary or at the level of uterus, you will get menstrual irregularities. So if suppose at the level of brain, because of stress, you will get lot of cortisol hormone in your body, in your blood, and that will hamper secretion of gonadotropin releasing hormone. So then you will get either scanty menses or heavy menses or the things like PCOS.
Hmm.
Then at the level of pituitary also, FSH and LH level, they will get disturbed because of your stress. But stress, it is not only psychological stress.
Hmm.
Stress happens because of your poor dietary habits. Happens because of your poor sleep. Then if you are not resting enough, not giving a proper rest to your body, that is also a stress for your body. So these are various kind of stress. So there are four pillars of your body. That is your diet, your sleep, your exercise, and taking proper care of your body, and then your mental health. These four pillars, they control your body and they affect the inner the hormonal control of your body, and because of that you get menstrual irregularity. Apart from that, another thing is insulin insensitivity or PCOD, the polycystic ovarian disease or polycystic ovarian syndrome. So now we are reading PCOS.
Okay.
So these also happen because of one genetic factor is always there, but apart from that, lifestyle diseases, lifestyle
Okay.
changes, they are very much responsible for PCOS or menstrual disorder. When you are having sedentary lifestyle, when you are eating junk food, when you are not having proper sleep, and when you are having a lot of stress, and even like see, there are girls who are very much obsessed with crash dieting or reducing their weight drastically. So this weight fluctuation also affect your body and you will get irregular menses. So these are few reasons. And along with that, diabetes is another cause for irregular menstruation. Thyroid disorders, and that is also another cause for your menstrual irregularities, and obesity. Obesity. So that also you have to keep in your mind. These are few reasons for because of that you will get irregular menses.
Okay. So sleep is
And
so
see,
important. Yes, ma'am.
very much, very yeah. See, I mean, these are the causes of irregular menses,
Irreg-
and when you have to consult a doctor, that is another thing.
Hmm.
Because
Hmm.
sometimes it happens that you feel that I'm getting a 5 or 6 or 7 days bleeding. That is okay for me because since beginning I am getting that much of bleeding. But that is not the normal bleeding. So 3 to 5 days of cycle and 2 to 3 pads if you are changing, that is normal. But if you
Normal.
are passing clots, if you are having you are changing pads frequently, and if you are feeling lethargic or weak, then it is a point of concern, and then that time you have to consult doctor. And again, if you are getting scanty menses also, or um, like increasing, if you are seeing the increase in your weight or irregular growth uh, of hair, then that is also a point of concern. So that time you have to go and consult your gynecologist, or take an opinion of a doctor.
Okay. See, lifestyle, you told about lifestyle. So lifestyle is also very important because I am always thinking earlier this problem were not there. Why only recently it created? Because nowadays everywhere you see that PCODs, fibroid, all gynecological problems, irregular periods, lot of things. So lifestyle also matters, your sleep matters, and nowadays ladies they are very much inclined to zero figure. So everything matter, everything affect on our body, not only hormone. Because what is, normal people think because of hormonal changes, or if in my hormones some some complications, and because of that only that irregular period. But it is not like that. As you explained, your sleep, your diet, your lifestyle, everything matters. So it's very interesting and very informative, ma'am, because lot of ladies they are unaware about these things. That because everyone, as I told, everyone know about hormones only, because we know that word only, hormones, hormones, and hormones. So we always blame to our hormones. Okay, we are not blaming, but actually all credit goes to us. We are responsible for irregular period,
Yes.
not our hormones and genetic problems. Okay.
Yeah, actually, hormones are all dependent on your lifestyle.
Lifestyle.
So, what you are feeding your body, how you are taking care of your body, that kind of, body will give you back
Back.
in that way. So, it is always your responsibility. God has given us such a wonderful tool. And
Correct.
if we are, and we take our body for granted, that is not good. We have to understand that this wonderful tool is given to us, and I am very much grateful to God, and I am very much grateful to body, and it is my responsibility to take care of the body. Definitely body will take care of you.
Exactly. It is, how it is now nature. We are playing with nature. So nature never take revenge, but it responds. So same way, your body will not take revenge, but it will respond one and another form of disease only, right? So we
Yes,
have to
yes.
think about it very meticulously. Okay, so Padma ma'am, another question is, how can women balance mental health during hormonal changes?
Okay. So during hormonal changes, see what happened, it is when the hormone they get disturbed, there is a lot of there is a storm like thing happening in your body.
Okay.
And when you are, it is just like taking care of your body. I mean, it is just like handling a ship when it is caught in the storm. That time you can't stop the waves, but you can strengthen the.
Okay, so my next question, Padma ma'am, it is how can women balance mental health during hormonal changes?
Okay, so balancing mental health during hormonal changes is just like taking care of a ship which is caught in the storm. So here you have to, I mean, you can't stop waves, okay, but you can strengthen your hull and you can guide your cells. This is
Yes.
how you can tackle that. You can balance the ship.
I
The
I would
same.
like to I would like to tell you have given so nice example. It's very fantastic example. Ma'am, could you repeat it, please?
Okay, so it is like taking care of a ship during storm. So here you can't stop the waves, but
Yes.
you can strengthen the hull
Yes.
and you can guide your cells so that you can take care of your, you can balance your ship. So this is the same thing happens when you are caught in the hormonal storm. So here to take care of your mental health is very important. If you lose your temper, then it becomes very problematic.
Hmm.
So first of all, you are going through a transition, a hormonal transition, and you don't know what is happening inside you. So first, the awareness is very important. And when you become aware of those changes, then you have to accept those changes first. And for that acceptance, there are certain things like, as I told you earlier, the hormones are controlled by your diet,
Hmm.
your lifestyle, your sleep, your rest, and your spiritual, you can say spirituality or your mental stability.
Okay.
So, if you are taking proper diet, it
Hmm.
will definitely help you. And for that, you have to take a balanced diet. So, what does that mean? What is balanced diet? So, many women they are not. I mean, they don't have clarity about the balanced diet. So it is. I always tell my patient that it should be 50% of carbohydrate, 30% of your protein, and 20% of your fat. But that is also very difficult for them to understand. Then I tell them take a one plate, and
Hmm.
in that one plate, half portion should be filled up with vegetables and salad and fruits. Then one fourth portion should be covered by your chapati, roti, or rice, and remaining one fourth portion should be filled with proteins like dal, paneer, then lentils or sprouts, or
Hmm.
if you are
Hmm.
non-vegetarian, then eggs, chicken, or meat. So if
Meat.
you take your food, or if you arrange your diet, then it will be helpful for you. And then having some most of the time they are I mean women they have vitamin deficiencies or mineral deficiencies. So having few nuts or fruits, they will help you to take care of these nutritional deficiencies. And along with that, you have to have supplements, because what happen, it is not possible for a vegetarian patient to get vitamin D, vitamin B12 from their diet.
Hmm.
So because it is you get it from non-vegetarian source. So for them, I always prescribe supplements, vitamin B12 supplements. Then even vitamin D. So though there is lot of sunlight, we don't expose ourselves to that sunlight, and we don't get vitamin D, enough vitamin D. So most of the time, Indian patients are deficient. Either they have insufficiency or deficiency of vitamin D. So I always tell them to have one capsule of vitamin D, 60,000 units every monthly. So it will take care of their, if they are insufficient, then it will take care of their vitamin D
Vitamin.
requirement. Yeah. So that is one thing. Then proper sleep, very important. If you are not taking proper sleep, your body will not get rest. What are toxins are created in your body, they are not going to excrete it. And then the rejuvenation of the body or the repair of the body won't happen. So that is another thing. And nowadays, like people, most of the time they keep on scrolling or watching mobile or watching TV, and they go to sleep very late. And that blue light of
Please.
the screen, it plays hack on their brain. Brain feels that still it is day, and then melatonin secretion doesn't happen, and then that melatonin is very much responsible for production of other hormones, and then it creates the problem. So, and third thing is exercise. So proper exercise is very important, because exercise will produce happy hormones in your body, and that will take care of your mental health as well. And apart from that, to take care of your mental health, you have to have friends, you have to have people, open communication has to be there. You can join the support groups, so it will help you to understand. If you are in the support group, you will realize, you will understand that many people are suffering from the same issue. So to be together, you can find out solution. So talk to your doctor, talk to your friends, and you will get the solution. And then develop hobbies like reading, or many productive hobbies are there, gardening. It will give exercise to your body also, and you will feel fresh. And reading is exercise to your brain, and gardening, dancing, these are the exercise to your body. So in that way, if you look at it, then you will get that benefit.
Oh my God, so
Yes.
many small things you told. Okay, that hobbies. We can do gardening. Okay, so it
Yeah.
is so small things. No need to meet directly to a psychologist. Okay, these small things you can do. And the way you explain very simply. Otherwise, we used to, means I feel it is so complicated. Okay, to balance our mental health and everything. But you explain with very simple method. You have to read books, you have to do gardening, dancing, whatever your hobbies. It's very important things and very small things, and it is so much beneficial. Because once you start to go psychologist and psychiatrist, then people also, your neighbor will think very differently, and we only feel not to concern any psychiatrist, because still now that taboo is there to meet psychiatrist.
Yes.
Actually it is not a bad actually. But
Mm-hmm.
people still now, educated people also feel, if anyone tell to them, no, I want to consult to psychologist, then they will see in different attitude. So we don't want to
Yeah.
concern them. But this very small things you have told about balanced diet, sleep, awareness is very important. Awareness plays important role. And oh my God, reading, I am doing reading. So I'm in that category. I'm in that category. Okay, very nice. Okay. So another question, Padma ma'am. What are the first sign of menopause?
Actually, you can't find out percent because menopause is not a shut off switch, like where you shut off the switch and you get the symptoms. It is not that way. It is a transition from uh, I mean, from perimenopause to menopause to postmenopause. So the hormones they slowly decline, and then at certain level the production will be stopped, and then you will get the menopause. When patient doesn't have periods for 1 year, for one whole year, then only we label her as a menopause, not before that. If she is getting periods in between, then it is not called as menopause, it is called as perimenopause. So during that period, how the hormones estrogen and progesterone, see this, during this period estrogen levels come down, progesterone levels come down, testosterone levels come down, then gonadotropins, the levels of FSH, LS, they are increased, and many things are happening at your brain level also, and there the whole mechanism of the body get affected. So first you get hot flushes, the your thermostat, I mean the temperature regulation of the body get affected, then the hormonal imbalance will be there, menstrual irregularities will be there, either the cycle will be scanty or the cycle will be heavy, or sometimes there will be no I mean menses will be absent for 3 4 months and suddenly you will get heavy bleeding. So that kind of problem or symptoms you will get. Then you will be emotionally unstable. Then you will get mood swings. Then your sleep pattern will be changed. Then you will get more anxious or irritable, or depression may be there, and then sudden weight gain will be there. So these are few things, the few symptoms you will find during menopause. Along with that, your bone health also will get affected because of estrogen, because the estrogen protection is uh, gone out, the strength of the bone will also get reduced, and you may suffer from osteopenia or osteoporosis. Then estrogen also give protection to your cardiovascular system, so you may get hypertension or some cardiac diseases will be there. So that is why how your age is increased. It is always because these changes are always happening in your body, but you don't pay attention to it. So if you have annual checkup after the age of 35, doctor will be able to pick up those problems in early stages, and then early intervention will be possible.
Okay. So what is important? We have to listen our body. But you know, Padma
Yes.
ma'am, we all know only we what we think, if we have mood swings, if we get frustration, or if we get angry in no time. So we always label, because of menopause. Because of menopause. Okay, because everyone knows that only because of menopause, that hormonal changes, because of that mood swings are there. So we consider that things only. But you told, if we miss entire 1 year of our menstrual cycle, then we can say that it is a menopause, right? Okay.
Yes.
It's okay. Okay, so I have covered only 5 questions. Actually, I want to ask many more questions, but we don't have time, and you also, your time, your schedule is very hectic. But yes, I am sure that this conversation definitely will helpful to all ladies, because Padma ma'am,
Yes.
though I am a nurse, but whatever you told, I knew only 10% or 15% only, to be honest. Otherwise, everything was very new for me also. So what is about another women? They are not nurse. They are some ladies. They are housewives. So they don't have that much of knowledge, because in offices, in professional, mostly they they conduct one session, gynecologist session, or they have that type of programs. But what is about housewife? They don't have any idea, because no one tell them, no one suggests them. And we mostly use gharelu nukse and that home remedies, but every time it doesn't work. Sometimes we have to take help of professional only, gynecologist, especially gynecologist only. So I believe that, I'm sure that this conversational video, this our video will very beneficial for housewives, right? So I would like to say you thank you. It is not enough actually to say thank you, because I know how much gynecologists they take to speak also. Okay, what is their fees to speak only? But you have given your valuable time, and it is not because of my love, I know, because you have lot of concern of homemakers and mostly ladies. So that's why you took some time. It is not because of share of my love only, I know that. So yes, I am definitely, I am very much thankful. And so I would like to tell my viewers also that if you find this video, if you found this video helpful and important, then please share, like, and subscribe. And I would definitely, I will call Padma ma'am again and again on my channel, because I also want to enhance my knowledge. Though I am nurse, I don't have that type of gynecologist knowledge. Okay, women's health knowledge and those things, because we always take it for granted. Also, we are not taking seriously. Frankly speaking, Padma ma'am, I also never ever go to gynecologist for annual check. Sorry, but but I know what is the importance. I know, we know everything, but we are not implementing those things. So it is it is a reminder call, we can say, to all
Yeah.
ladies through our this video. So Padma ma'am, if you
Ac-
want to say something, you can. Yes.
Yeah, actually, I also enjoyed this conversation with you, Sangeeta. And what I feel, like I told you that I'm passionate about a blend of modern medicine with meaningful lifestyle changes. And most of the time, if you take good care of your body and if you maintain a good lifestyle, and you have to, like, nowadays I am seeing so many adolescent girls suffering from all these problems. So if mother knows about the meaningful changes in lifestyle, definitely she will help her daughter to
Hmm.
inculcate those habits, and
Habits.
that will help us to improve the health of that girl and health of that family as well. So that is like, it is a long term process, but if mother is interested in that, definitely she will. It is not only for daughters also, it is for boys also. As for their sons also, it is very much useful. So healthy diet, drinking lot of water, that is also not doing. Many children, they are not doing that thing, even ladies. Like,
Yes.
when I ask them question, how much water you drink per day, then they will say 1 glass or 2 glass. That is not enough, because your blood is 70% of water, and if you are not drinking enough water, what is going to happen, that you just imagine. So you have to inculcate those healthy habits. Yeah, regular exercise, healthy diet, drinking a lot of water, having enough sleep, and having a good mental status by inculcating or developing different hobbies, having friends, and having open communication with your family members and with your friends. That will definitely help you to live a wonderful life.
Wonderful.
And I wanted to give that message to all your viewers. If you change your mindset, definitely you won't need more medicines. 50 or 60% is in 60 or 70% is in your hand. Your health is
And
in your hand. Only 30% will require the
but
medications.
but
So
ma'am, I would like to tell, I know it is not actually good on telling this platform, but if everyone follow that pattern, that what is about gynecologist, that is
no, no,
also
no, no, no.
true. How you will
Yeah,
get
no, no.
patient?
No, see, if we explain, that is what happening in my OPD. Yeah, because I am explaining them very nicely, they come to me just for getting things cleared.
Clear.
And if this is because, if one daughter is having any problem, and she is very much obsessed with having junk food, and if I explain her, or if sometimes I scold also, but
Hmm.
that is for their good. But they understand the importance, and next time she will bring another girl, and she will tell
Oh.
me that my daughter has benefited, and now you treat this girl, you explain everything to her, so that she will also understand the importance of healthy
Yes,
lifestyle.
ma'am. Yes, ma'am. It
So
happens,
yeah.
in our village also. What happens, if we feel good now, we always tell to our neighbors, you just go to that doctor, na, that doctor is very good. So like that way, we are doing advertisement of that doctor. Yes, it happens. It happens. And some patient,
Yeah.
I told you, some patient, they don't want treatment, they don't want medicine, just they want na good words, they just want some good advice and good words and affection and to speak with doctor. If they get those things also na, then also they feel, relaxed, and they feel I am now okay. And it affects to our body also, to our hormones also, because if we are happy inside, if we are happy, then definitely we are not feeling that sickness and that illness, right? So it works magic, like magic. Yes, yes. Whatever
Yeah.
you have
Yeah.
given, I am damn sure that all viewers, they will keep in mind, and they will advise their daughter, and they will take care of their daughter also. Because see, we are here, why we want to take care of what I'm telling, that is a legacy we have to give our children. Good things, whatever we are, healthy things we are following, that same things legacy we have to forward to our children, instead of keeping money and property on their name. You just give them good healthy lifestyle, and just teach them that healthy things. It is very much beneficial instead of giving property and those things, right, Padma ma'am?
Yes, yes, definitely, definitely.
Yes, yes. So thank you,
Yeah.
Padma ma'am. You came here and you gave us a lot of advice and so many things, I can't tell you in words, but it's really nice conversation because, it is not impromptu because we decided very long time only, but the way we speaking with each other, it's a very impromptu, like, very friendly conversation. And actually, gynecologists are not like that. Gynecologists are always very strict. Sometimes, I'm telling you truth, they are very rude also. And it is not actually they are rude. The thing is that sometimes they have to behave very firmly. Otherwise, patient will not listen to them. So once you also told that sometimes you scold also your patient because it is very important. Otherwise, if you just tell them everything, very good way, then they will take it for granted. They will not listen to them. So you should have to, to behave them sometime rudely in the sense firmly. Every time softly
Firmly, yeah.
will
It
not
is
work.
firmly. It is not rude, yeah.
Not
Because
rudely. Yeah,
sometimes
I use
little,
wrong word. Firmly,
ah,
firmly. But
yeah,
I
it is
used to
like,
feel. I used to feel when I was child, means when I was small, that time I used to feel, no, gynecologists are very rude actually. I used to feel actually, but it is not rude actually. It is they are firm actually. They behave
yes, it
firmly.
is little bit of discipline is always required, and if you have to be firm with that, and then only it will change the way of your life.
Exactly.
So with small habits, you develop the small healthy habits, and it will definitely help you to
Yes.
live a wonderful life. That is
Exactly.
what I wanted to share with your audience.
Yes.
So
Yes.
it was a nice conversation, and I also enjoyed a lot. So
Yes,
thank
yes.
you.
I also enjoyed a lot speak.
Yes.
Sometimes I spoke irrelevant, but it's okay. I don't mind those things. Okay, Padma ma'am, thank you once again.
Okay, bye. Bye.
Okay, bye. Yeah.
Good night.